Hi, I'm Dr. Rudy Cashman. Welcome to the show. I think that you'll find this fascinating, and this could be extremely helpful perhaps to you or some friend. I think we all have a friend or a relative or someone or somebody at work who's got diabetes, especially type 2 diabetes, although we're speaking about type 1. And this is a very hopeful talk because I'm totally convinced after extensive study, writing and reading many books, and I'll give you the names of some of these to assure you this is science, that 90% of the time you can get rid of type 2 diabetes. But hardly anybody is teaching it or promoting it. The mayor has called me, I think, on 9 different occasions now, Dr. Wellness. He knows where I'm coming from. And so let's get on the road. I mean, it's a world epidemic. We have an explosion of type 2 diabetes. Let's differentiate type 1, type 2. Type 1 generally is considered autoimmune disease. It can be from an infection. It can be from food. Some people even think, they may call it an autoimmune disease, but there are people publishing papers that it's related to milk consumption to some extent. So, but anyway, this is usually seen in children, but type 2 diabetics who will wear out their pancreas and no longer secretes any insulin, they become type 1. So the largest amount of type 1s actually are the ones who were type 2. Many of the patients today are not properly diagnosed. They're tested too late along the line from the blood testing. 150 million people are walking around with pre-diabetes. They don't even know it. It's a serious problem. So we'll be speaking about blood testing. It's a world epidemic. And I quickly mentioned to you how hopeful this is. Dr. Katz, the biggest public health official in the nation from Yale University, says on the cover of this book, Disease Proof, he says, 93% of type 2 diabetes can be prevented, stopped, and reversed, just like I've been saying. I read that book after I've been saying it for a long time, but that helps confirm it. Here's another book, The 30-Day Diabetes Cure. This came from a patient who had been going to the Cleveland Clinic, published by Stephen Rippich, and someone had read it who took the patient there. He says, Rudy, the book reads exactly like you wrote it. You know what I like about it? It's just another opinion. Dr. Franklin House, he ran a lifestyle clinic in Arizona, the 30-day miracle. He's saying it can be gone in 30 days, just like I'm saying. Dr. Furman, Dr. Esseltine, Dr. Mark Hyman, Blood Sugar Solutions, all telling the same story. I could fill this table with books confirming what I'll be speaking about. So let's get on the road here. So it's a world epidemic. Why is this happening? I think it's a serious problem. I think we've been captured by industry. You know, they want to take the VW people with the ozone emissions, which, I doubt is affecting us very much, and they're calling them criminals. But just think what's been happening to us. Just think about it. The pharmacy industry constantly pushing drugs at us, some which helped. The invention of insulin helped a lot of people. It still helps a lot of people. But it's an anabolic hormone which causes weight gain, obesity, which promotes diabetes. Like I said, it helps some people. And constantly, when you're going in for treatments today, you go to the hospital, for example, and everybody's prescribing medications. That's, it's the script to the ill. Only 1% of the money spent on diabetes, 1% is spent on prevention, when 90% of it could be prevented. What do you think? I mean, what do you think? The agricultural industry promoting their products on us, and the government supports the price of sugar. Sugar is the booger. That's what's causing it. That's what's causing it. For 40 years, the American Heart Association was telling us that's the fat. The ADA, the American Diabetic Association, telling us it's the fat. It's not the fat. It's the sugar. The latest books and literature clearly confirm that. It's the sugar that causes insulin resistance. Fat doesn't raise the insulin level. It's sugar that raises the insulin level. the pharmaceutical industry, the government supporting the price of sugar and corn and wheat. Could you believe it? They support it through lobbying money, and then the government, the congressmen, promote it because they're getting all this money promoting these products to us. Fast food, for example, which is making us sick. Too much sugar, too much fat in it. So it's the manufacturing, fast food, agriculture, the government, the pharmacy, yes, even the hospitals. You go in the hospitals and what are they serving you? Promoting form these groups, and it's all about medication and pharmacy, how much money is spent on wellness. At least I represent the Lutheran Network. I'm a wellness director there. At least I'm out there promoting it. But how much have you heard about preventing this plague, this epidemic? 1 out of 2 people walking down the street is pre-diabetic or diabetic. The complications of type 2 diabetes occur in pre-diabetes. We're diagnosing people at stage 3 or 4 when finally their blood sugar is up. We need to diagnose them at stage 1, and I'll talk about the test. What are the complications? Blindness, cataracts, heart attacks, unannounced heart attacks. People won't even have angina. They'll grab their chest, and they're dead. First sign of heart disease. Not that uncommon, especially in women. In women, it's not angina indicating a sign there's heart disease present. It's sudden death, and occurs quite a bit in pre-diabetes, heart attacks, strokes. 75% of uterine cancer is due to being overweight and diabetes. Ovarian cancer, about 50%. Many skin diseases. Most of the renal transplants and dialysis is occurring is in diabetics. But 100,000 people get their extremities amputated because of diabetes today. When you can stop it, prevent it, stop it, reverse it in 30 days, 90% of the time, what do you think? Are we going to allow industry and these things that I've mentioned capture us and lay down for that? What do you think it's all about? Have you ever heard of the dollar sign? What it's all about? I mean, clearly it's all about, and we need to revolt and turn this around. And this is I'll be doing here today. So, number one is I only mentioned a few of the complications. There's about 20 others. Okay. Memory loss is a big one too. A lot of dementia, they may call it Alzheimer's disease, but it's dementia from sugar hooking to proteins interfering with neuroconduction, and you lose your memory. A lot of diabetics have that. They say it's Alzheimer's. It's not Alzheimer's. That's a different entity, not as common. It's dementia from these proteins and these sugars. Early testing. We need to test people a lot earlier. There are 5 stages to diabetes: insulin resistance, hyperinsulinemia, then hyperinsulinemia, insulin resistance, then stage 4, or you're diabetic, and stage 5 to amputate, you go blind, have a heart attack or a stroke. We need to catch you very early. And what we're doing today, you know, you're overweight, we're doing screening at General Motors, and we find your blood sugar is normal, but you weigh 220, and we didn't check the serum insulin. That's a mistake. The test that you want is a 2-hour glucose tolerance test with the fasting blood sugar and the serum insulin. Serum insulin, those two together, and you find the serum insulin is elevated and the blood sugar is normal. The reason being because of triglycerides elevating the blood, these receptors on your cells. Insulin's job is to put sugar in the cell for energy. Okay, you need that, otherwise you're dead. And so the insulin level goes up, the pancreas is working like a dog, getting sugar in there, and the blood sugar is normal. But the serum insulin is elevated, but we checked only the fasting blood sugar in the first 3 stages or so of diabetes, and we missed the diagnosis. Remember what I said? A lot of the complications occur in pre-diabetes when you have insulin resistant. Insulin's resistant to open the door to get sugar in the cell. You understand insulin resistance? I've ever met a diabetic who knows what insulin resistance is. And normally, if you go to my other lectures, you can see I have an illustration of it, which is our fault, not their fault. It's our fault. Okay, so early diagnosis. And you want to know what the fats in the blood are, like Arthur Tech has the VAT test. And LabCorp has the nuclear magnetic resonance test, NMR, which will tell you whether you fats are elevated in your blood, which indicates metabolic syndrome on the path to diabetes. I suggest, the government does not even mention or recommend it. I think we should do it. They'll say it's too expensive, but I tell you, lab testing has become very cheap. Within a year or two, you'll be able to get all your tests, all the tests done, one drop of blood, $40. It's coming. It's coming. And I think we should screen people starting at birth every year, and we'll catch people on the way to diabetes when 150 million people are pre-diabetic. What do you think? We start testing them at age 35, like the American Heart Association says, and check every 5 years. Give me a break. Yearly testing, so you know if you're pre-diabetic, you exercise a little more, you lose 5-8% of your body weight, and guess what? You don't have diabetes. You don't get those complications, and you live to be 100. I wrote a book of that, Live to be 100, Amazon books. I got about 20 books on there. And so early testing, okay? That's important. Okay, now what to do? Suppose you're pre-diabetic or diabetic, or you want to avoid it. If you are pre-diabetic, diabetic, or for anyone, we got to learn to cook. 1/3 of the people claim they can cook, but we checked them, it's 10 or 15%. Okay, so learn to cook. Dr. Mark Hyman, who wrote Blood Sugar Solutions, his family does not start the evening meal. They don't even pick out what they're going to eat till he's home. He helps picks it out, and then he's part of the cooking process. The family sits around the table. A wonderful thing to do. Me having been a neurosurgeon for 45 years, I don't think they ever would have had dinner if I did that. But I recommend that highly. Learn about proper cooking. I think it's very important. I'm starting a cooking show next week, the same length of time here on public access with Callie, and the head chef from Trine University has agreed to come down in a chef's uniform. And we're going to start a cooking show to teach you how to eat nutrient-dense food, how to properly prepare it and cook it, because that's the clue. If you're type 2 diabetic, you want to get rid of it, and you're going to eat in restaurants all the time, it's not going to work out. It is just not going to work out because what's their job? Their job is to make some money, and I don't blame them. They got employees to pay, and they'll be pushing breads and desserts and things and at you. I mean, you can survive a restaurant, but it takes a lot. You know, maybe once or twice a week, but boy, if you're going there every day, your diabetes is not going to go away, especially if you're going through buffets and things. You'll eat a third more if you go through a buffet, incidentally. And it's very, very difficult. So I recommend learning to cook. And there are many good books out there that would teach you how to do it. But watch our show, and because I thought it's so important that I'm going to take it up. Try to follow, and Mark Hyman wrote a book on it, and even this 30-day diabetes book here, and the Diabetes Miracle, Franklin House, they have a cookbook. Sugar is addictive. Sugar is the booger, and it's 4 to 8 times more addictive than cocaine. It affects our neurotransmitters of our brain. So, but you can detox some sugar a lot quicker than you could from cocaine. I mean, your appreciation for cravings for sugar from the brain will go down seriously if you just eat a lot less sugar for about 10, 20 days. And then you don't go back to doing the way you ate, obviously, but you can introduce it a little bit more. But so you have to learn, read labels. You got to learn to read labels. Sugar has 50 different names. You can look up it in computer or books. It's 50 different names, okay? Agave, molasses, all different names. You got to learn the names. Fructose corn syrup, particularly bad one. You need to know that, okay? And sugar, incidentally, table sugar is 50% glucose, 50% fructose. Fructose is metabolized in the liver. Yeah, it's the same fructose as in fruit, but as long as you eat it with fiber and fruit and berries, and I wouldn't restrict eating fruit, for example. Not that if you ate 10 pieces of fruit a day, you might get heavy on that if you don't watch what else you eat, but fruit's fine. But what I'm saying is fructose is metabolized differently than glucose. So you need to know the different names for sugar. And like I already mentioned, many of us are addicted to sugar. We need a few days of maybe severely restricting it, and your body will readjust to it. Notify you, if you're pre-diabetic, notify your doctor. If you're checking your blood sugar, of course, you need to maybe increase a little bit. Remember, 30 days, that won't be necessary. Franklin House, when he had people come to this clinic in Arizona, took away the oral medication in 1 week. Did I say to do that? No. Check with your doctor, but check your blood sugars more frequently. Know the symptoms of hypoglycemia, the low blood sugar, and hypoglycemia. You know, dizziness, vertigo, seizure, tiredness, because you could be driving along and your sugar drops or faint at home, have an injury. You have to know the symptoms of hypoglycemia, hyperglycemia. If you look at my PowerPoint in CashmanHealth.com, yeah, it's all on there. It's in many books. And so let your provider know that, try to avoid, unless it's an emergency, the pill to the ill. Say, hey, wait a minute, for 2 months, let me try eating right, or 1 month eating right, and see if I make some progress. And if I then absolutely need a pill, well, fine, take a pill. But pills can actually aggravate it, especially insulin. If you have to take it, you have to take it. But insulin is antibiotic. It makes you fat. Insulin causes dementia. Insulin reduces immunity. Insulin causes cancer. Insulin causes arthritis. It has many other actions. As life-saving as it was when it was invented in 1920, it has many complications associated with it. And so make a plan, okay? Sit down, piece of paper, and make a plan. What do I in general recommend? About 70 to 80% fruits and vegetables, you know. And I mean, some people go vegan. I mean, they just don't eat any meat products, cheese, or whatsoever. That's not necessary. If you have advanced vascular disease, you've had 3 heart attacks and angioplasty, you've been operated on, be a vegan. You're going to need it to save your life. But I say 78% fruits and vegetables, 20% say organic meat products, for example, fish from the ocean instead of the pond, for example. Incidentally, they're making now fake meats out of vegetables. The other day I had beans, and I had what looked like regular beef to me, but it was made from peas. And after all, there's plenty of protein in plants. They reassemble it. They can frankly make meat out of it. There's no cholesterol, no fat, no cancer factors, much healthier, and taste it just like beef. That industry is exploding. So if you want to avoid animal products, which would be even more helpful, I didn't say you had to do it totally, but it'd even be more helpful, and you avoid the cancer factors, the cruelty to animals, the stress on the environment. It takes 10 times more energy to make a pound of beef than a pound of vegetables, for example. So it's eating up the energy of the universe to provide a steak for you, which is really not healthy. Did I say zero? No. 80-20 sort of, and I sort of designed Rudy's plate after Rudy Notre Dame, although my name's Rudy. Half the plate of non-starchy vegetables, another quarter of the plate could be starchy vegetables, the other 25% could be meat products or fake meats or nuts, and see and find out where it came from. What that animal ate is what you'll be eating. Okay, if it's fish from a pond, it's 40% fat. Fat corn products, fat product to make the fish fat, and then you eat it. That's not healthy for you. It's full of bad fats, omega-6 fats. We need some fats, but you need omega-3 fats. Okay, the good fats that conduct the computer, the internet of your body. That's what jumps from your 70 trillion cells that communicate to each other with the omega-3, omega-6 fats. So not all omega-6s are bad. We need a ratio of 1 to 1. We're eating like 20 to 1 of bad fats to good fats. So I didn't say necessarily bad things about fats. It's sugar is the hooker in the booger. Okay, so in generally, a plant-based diet, generally, 70, 80%, your blood sugar is going to drop quickly. You're going to be very healthy, probably live to be 100. You don't have to be 100% about it, but you need to gain some information, okay? And you need to maybe do a little bit of reading, go on the internet, attend some of our lectures. But this knowledge, frankly, will lead you there. And try to head for a normal body mass index. Find out, hey, am I 20 pounds overweight? But if you get to a normal body mass index, probably your diabetes is gone. It doesn't even take that much. But a 5, 8, 10% loss of body weight, your diabetes probably, type 2 diabetes probably would be gone. Although there are what are called skinny fat people, especially Asians, who have abdominal fat and fat in the liver, and they'll have diabetes in spite of being thin. That's a real problem in Korea and Vietnam. So you need to know it's the blood work. It's the blood work, even if you're skinny. I know a teenager recently looks perfectly skinny, looks very athletic, but had horrible blood work. And we then found out next to his fancy private school, he goes, this is a prominent family, he goes to a fast food restaurant next door. That's all he eats. And it's your blood work that determines how healthy you are, not just how you look, okay? Incidentally, if you eat a vegetable type way of eating, there's a genetic structure in it, there's mathematics in it, Fibonacci numbers in it, and if you have a real serious weight problem and it's beginning to affect how you look or how you self-perceive yourself or other people perceive you, the genetic information in fresh vegetables, the biomathematics in fresh vegetables will rearrange your body. I have pictures on my website, cashmanhealth.com. Look at the PowerPoint. You'll see 3 people who had a serious problem with their weight, and they look like movie stars. That's called epigenetics. Epigenetics, as to what you put in your forks, your fingers, and your lifestyle can affect your gene structure and rearrange you just like a flower. Perfect example there. That's exciting to me. Epigenetics, which not many people know anything about, is exciting. So yeah, you know, keep it simple. This isn't that complex, okay? Take up some exercise. That's important. But, you know, if you just walk half hour, an hour a day, for example, maybe do some mild weightlifting, 5, 10-pound weights, a little bit to build up your muscles a little bit, improves the metabolism of your body. A muscle at rest will burn 50 calories a day resting. Wow! You put 5 pounds of muscle on you, well, let's say 1 or 2, that burns 100 calories a day. Isn't that fascinating? So exercise will reduce insulin resistance. But if you're serious about, I need to lose some weight, just exercise won't do it. That's maybe 20% of it. It puts you in the right attitude, makes you feel good. I do it every day. But if you feel like I want to get rid of my diabetes, then you need to learn to eat right. Be very hard to do without eating right. Food of color. Add mushrooms and onions, and you'll be healthy and nothing flat. Franklin House, in his clinic in Arizona, frankly, would cut the insulin down about in 2 weeks in half. I didn't say to do that. But see what happens. Your sugars will drop quickly if you eat right. Eat right, okay? And avoid trans fats. Trans fats are vegetable oils. They hydrogenated, and that's margarine. You find it in a lot of your foods. Read the label. Matter of fact, you should eat food at least half the time that has no label on it. Then it's organic and it's fresh. Get interested in organic farming like I do. I go to Mr. Hawkins' farm outside of Manchester, and every Wednesday he delivers fresh vegetables to Lutheran Hospital between 3 and 5. I pay a little bit of money every month on it, and this is what I ate last night. And it was a beautiful collection of vegetables, very healthy, very healthy. So to get some interest in organic farming, do it. Plant a garden by your house or join a club that's doing it. I'm doing quite a bit of that now, and we need to expand that throughout the city. We're going to turn this epidemic around. Incidentally, type 2 diabetes is more common in certain ethnic and racial groups because of their genetic structure. They have the thrifty gene. They have their genes were changed through slavery because they ate sugar cane because it was starving them. No breakfast, no lunch, not enough supper, and they ate sugar cane while they changed the gene structure. So when they eat the wrong food, their bodies explode even worse. Well, we all have this problem, okay? But they even have it worse genetically, so they need to be very sensitive about what they're eating. So avoid oils. Oils are 100% fat. You know, maybe a tablespoonful of olive oil, which is the best of the oils, has some omega-3 in it if you need to. Maybe to saute some food, or I put it on a baked potato instead of butter and oils, but just a little bit, okay? And watch alcohol intake, because alcohol is a sugar. You're sugar. You're going to drink a lot of alcohol, you get a pot belly, it makes you fat, that causes diabetes. Maybe if you need to, I didn't say to do it, 2 or 3 glasses of wine a week, okay, but you do more than that, there's going to be trouble. And it's a sugar. You get diabetes, that causes insulin resistance. So to cut back on alcohol, smoking causes insulin resistance. So you have to keep an eye on that. Increase your consumption of beans. Beans have a lot of fiber in them. Fiber is your friend, okay? It's your friend. You won't absorb all the food because of fiber. And the fiber will carry out a lot of the calories into your stool. And vegetables, incidentally, have a lot of water in them. So if you eat a vegetable way of eating, you'll probably lose 50% of the calories because of high water content, high fiber content. It takes a lot of energy to break up the vegetables in the fruit to convert it to sugar, because you need sugar to live. You see the point? When you can lose 50% of the calories on eating right without doing anything else, that's a great piece of news. Keep that in mind. That's a thermic effect of food. You ate 1,000 calories, say, of vegetable fruit, you're going to lose 50% in metabolism because of water, fiber, and the energy of metabolism. Wow, that's good news, okay? You combine it with a little bit of AOL, activity of living, okay? Use the stairs instead of the elevator, walk the dog, or go dancing, pick an exercise that you like, okay, that you like, so you're more likely going to do it, and increase your activity of living. That's the reason today, I call it sitting disease, at places of work. Now, for example, I was at Asher Insurance Company yesterday, marketing company. I think they had 10 treadmills there with computers on them. The employees were treading away and using the computer. Some people were standing up while they're working. If you stand up, that triples your calorie burn. They are increasing their activity of living, and I compliment them for doing that. So increase your intake of dark greens, leafy greens, because they're full of vitamins, minerals, phytochemicals. 25,000 phytochemicals is the interaction of vitamins, minerals, and phytochemicals that lead to good health, okay? And you're going to lose a lot of calories. The symphony, the mosaic, the music, orchestra of interaction lead to good health. That's what leads to good health. Animal meat products, steaks, for example, have IGF-1, cancer factors in them. They have cholesterol in them, a lot of fat in them. They're not good for you. And in the last 150 days of beef, you know what they do? They put them in a cage. They put in pesticides, herbicides, don't remove the excrements, have a trough going by full of fatty stuff to fatten them up. Then they slaughter them in not too friendly a way, and then you eat it. You think that's a good thing? I don't think that's a good thing. And the same with lamb and pigs, same darn thing. They do it to chickens. Put them in a little cage, don't let them outside, open the doors, and then you call them organic, okay? And they feed them fatty products to fatten them up. And the more they weigh, the more you pay. And then you eat the darn thing. So get organic chickens. I buy my chickens and my eggs, my organic eggs, from Mr. Hawkins' farm in North Manchester. I buy them from him, very healthy. And I don't eat a lot of that, but I do eat some egg whites, for example, an occasional full egg, because it's protein, it's not sugar. You can overdo it with eggs, but in general, you know, especially egg whites are good. A whole egg here, 2 or 3 a week, no harm done. Okay, let's talk about sugary drinks. 50% of being overweight is sugary drinks. The amount of sugar in some of these, 18 ounces, what I get in 40, 50 grams of sugar. We're consuming about 200 grams of sugar a year, and some about 400. Years ago, we consumed 5 or 10 grams of sugar. You see the problem? That's why we've had this explosion of type 2 diabetes, increased rates of cancer, actually an increasing rate of type 1 diabetes, 1,000% in 100 years. They're not totally sure why, and they're thinking maybe type 1 diabetes is not an autoimmune disease where your own immunity attacks the pancreas. Maybe it's a reaction to a bacteria or a virus or a chemical we take in. We take in about 80 chemicals a day, sprays and things that are used in the environment, and that has increased type 1 diabetes tremendously. The consumption of milk. I don't want to say a lot more about milk, but I'll tell you this. Read a book called by Key On. It's called Whitewash. If you drink milk after reading that book, I would be surprised. The casein in milk, the protein, a lot of people are allergic to the casein in milk. We don't have the enzyme for it. Some racial groups even have no enzyme for it. That's why their stomachs get upset when they drink milk. I use almond milk, no fat, no sugar. And if you need to drink a little bit, I add that to the coffee. Not that is even needed. But no animal drinks the milk of another animal except us. There's 24 hormones in milk. So if your children are drinking a lot of milk, they may start menstruating at age 7 or 8 instead of the teenage years, 12, 13, 14, whatever. That lengthens their years of life. They're exposed to estrogen. That increases their breast cancer rate tremendously. That's been proven, okay? Estrogen is what causes, part of the cause of breast cancer. Incidentally, being overweight is related to breast cancer, uterine cancer, and ovarian cancer, but you hardly ever hear from industry. Do you hear that from industry? That you can avoid 50% of breast cancer by getting normal body mass index? You ever hear from somebody? Very rare. I'm the one out there speaking it, but I don't hear it very often from any other part of industry. So avoid refined carbohydrates, flour, that's sugar, okay? What are breads? Breads end up, essence, being sugar, and they've been genetically hybridized and modified, okay? A Dr. Berlow in 1948 at the Rockefeller Institute hybridized wheat and increased the yield 10 times. They went all over the world, stopped people from starving, but they never checked it on humans. And we find now, wheat used to have, used to be einkorn, which was 12 chromosomes, then Emma, 24 chromosomes, and now it's called triticum, over 120 chromosomes or so. So it's different. Wheat bread, like at the Mediterranean area, a pound of bread used to weigh 5 pounds. Now it's a quarter of a pound. It's not for much sugar. White bread is not for much sugar. So you have to learn, and so eating a lot of white bread, not consistent with diabetes. So avoid flours and breads. If you need to feel like you need to have some bread, try Ezekiel bread. It's made from sprouts, a lot less sugar because of that. It still has the vitamins in it and everything. If you're gluten sensitive, then because it has gluten in it, just remember that. But you can get in the frozen section of most supermarkets. That's what I use. I'm going to have some bread. And it is very, very dense from nutrients and things that are in there. It tastes good too. And I will mention avoid alcohol, avoid smoking. I think this is a good start. The American Diabetic Association, if you read their site and how to get rid of type diabetes, it's 800 pages. I've read it 3 times. But they have in there the fat theory of diabetes. It's wrong. It's all over the literature. It's wrong. But they get paid a lot of money from industry, and I think this could be the reason. And the amounts are staggering amount of money they're paid by industry, and you have to have a license to use them on the label of some of the food, like a candy company. Can't believe it. The ADA got money from a candy company. Can you possibly believe it? Yeah. So there's conflicts of interest there, big time. On the 30-day diabetes cure by Dr. Stephen Rippich, he details it in detail. It's right in there. I'm not making this up. And conflict of interest there. And and they want to put VW people in jail and call them criminals. Give me a break. Give me a break. This is killing millions of people all over the world. And the American Diabetic Association accepts money from industry. It's not believable. But I've read the 800 pages 3 times. I notice the local YMCA is teaching their course, 61 lectures. Come to mind 1 or 2 talks, and I think you know what the story is all about. Sorry for being a little critical when it's killing people, injuring people, amputating people, people walking around on their ankles from diabetic neuropathy. I think we're dealing with something very serious, and I feel we've had an attack from industry, and we must fight back. And this is what I'm doing today. Pharma, for example, I mean, some of the drugs are just great, but medications, you know, you go to a diabetic clinic, and what's the first thing you talk about? Prevention. Hey, you knock off 10% of your body weight, and then we'll try the drugs. That's not the story, unless it's an emergency, okay? I mean, the blood sugars are 500. You may need insulin for a few days, but always volunteer. Doctor, can I follow a wellness program? And then the provider must see you back in a month. You can't say, well, I'll see you in a year. That's not going to do. Most of us, it takes more than that to motivate us. Obviously, it takes more than that. I recently took a guy at Planet Fitness where I work out, and people ask me occasionally, you know, to get some health questions. And there was a gentleman there a year ago, a truck driver, weighed 360 pounds. I have no memory of him. He said, Doc, you remember? Yeah, I don't remember because I talk this way 5 times a day, okay, at least. So I didn't recognize him. And he said he went from 360 to 210. He's on my cashmanhealth.com website. You see his picture. He looks beautiful. He parked his truck right in the parking lot because on the weekends it's empty. He says, now I'm going to tell you something that you would remember. Apparently, now I did remember. I walked out to the truck, measured it was 55 feet around the truck, and I asked him before he started that day to divide the 55 into a mile to walk around the truck for 1 mile. Then stop twice a day and do the same thing, and once at the end of the day, that's 4 miles. And then he says, I don't like to read, Doc. So I said, well, why don't you listen to Dr. Oz? Who I don't agree with everything he's on there, but 80% of the stuff is fantastic. Most of these authors I quote, he's had on there. And he listened to that, gained information, and now he weighs 210. See his picture right on the website, or if you see me personally, it's on my phone. And so it can be done. He did it. And I'm concerned, of course, the number of people who drive regularly for a living, who probably have what I call sitting disease. Sit for 2 hours is like smoking a cigarette. That's true. And then then you go to some of these fast food restaurants. They stop on the highway, nothing but donuts and muffins and white bread. And can you imagine what's driving down the highway today? I wonder if they stopped 100 truck drivers and checked their blood sugar, we'd all pass out. Concerns me a great deal. So we need to stop, prevent, and reverse this disease. 30 days if you eat this way. I think most of the medications be gone if you check with your provider, but you got to try to follow it. You know, 100%. I'll take 90. Okay, if I had to, I'd take 80. So learn about the different names for sugar. Sweeteners I would not use because even stevia, which is the one from nature from Mexico, is the friendliest of them, but it's 200 times more sweet than sugar. So what's the next thing you're going to eat? I know someone pretty darn well, and they have a little bit of a lot of diabetes, her side of the family, and she uses stevia out of a certain herb drink all the time. But what's the next thing you're going to eat? Something sweet. So don't use any substitutes. Water is your drink, 8 ounces a day at least. Use some lemon and lime, and with it, drink a lot of water. I think it's important. Reduces insulin resistance. So forget about artificial sweeteners. Get bread out of your life. I mean, it's a book called Wheat Belly by Davis. Excellent reading, and he explains to you in detail about gluten and wheat and the effects it has on you. And amylopectin, which is the main thing in wheat, get rid of it. If you have a pot belly, it'll go away, bang, quick. I didn't realize I might have been 10 pounds overweight, didn't think so, but I'll be darned. After I cut out any type of bread, I had to go the tailor shop and take my whole wardrobe and bring it in. And then turns out, I work out regularly, lift some light weights too, not heavy weights, light weights, and use it, work out and play a significant amount of tennis, and I'm still the same weight, but I'm still getting, my waistline is still going down, I think, because I've developed musculature even as at my young age of 39. I celebrate my 41st anniversary of my 39th birthday the other day. Okay, let's have a laugh here. Let's have a little laugh here. Industry is a real problem here. Again, the government who doesn't support the price of sugar, and they're lobbying these congressmen and these businesses. Well, they're trying to make a living. If we went to the fast food restaurant and we ordered good food every day, what do you think they'd be serving us? So let's not blame them totally, okay? If we went in there and ordered good food every day, they'd be having it because they're still making some money. So let's not totally blame them, but they do. The government reduces the sugar a little bit, they increase the fat, and vice versa, and it's all making us sick. But I'm concerned about the medical community. They didn't put prevention at the top of the list. That concerns me a great deal. They certainly should. And I would say, if you're eating somewhere, there's no harm in saying, why are you serving this when I'm trying to get well? I'm in a hospital, and I'd say things are only going to change. You step up to bat. Providers need to step up to bat. Okay, I'm not patting myself on the back, but I've tried to step up to bat. My mother said, "Be a doctor." I'm trying to be a doctor. Okay, so we have to properly put responsibility somewhere. Okay. And the medical, and I'm a little bit critical of medical school because they teach very little prevention. There was a lady doctor at my 50th anniversary of my medical school. She reviewed the curriculum across the whole state of Indiana, and there was nothing in there about prevention, and there was nothing in there about proper nutrition. Nothing. And I will admit, I did stand up in front, my heart going bum, 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 and took the dean, head of the neurology department, head of the cardiac department. I took them on about it because this must stop in the nation, in the world. Okay, the U.S. ranks 37th in the world in health. Indiana ranks about 40th in this nation. So don't you think this could be a political issue? I did actually meet with a gentleman running for governor about this, see if he'd take it as a political issue. I'm going to meet with both running for this to see if somebody would pick it up as a political issue and then go into the state and it's information. We lack information. It's even in the Bible, Hosea 6:4. We lack information. I don't blame the public. I blame us as providers. I blame industry, pharmacy, the government for promoting illness on us. They are promoting this on us, and we must stand up against it. Okay, for example, some of the foods that we eat have 83 active pesticides in them. Yeah. They've checked the umbilical cord of little children and find there's over 200 foreign chemicals in the umbilicus of a newborn. Yes, this cannot continue. Okay, the U.S. is 33rd in the world out of 195 countries in infant mortality. Wow, we have all this modern equipment, and it's just not believable, but we are. We are 47th in life expectancy out of 226. We are 47th in life expectancy out of 226 countries. Wow, it's horrible. We're 13th in cardiac mortality in spite of all this modern angioplastics, cardiac surgery. We're still 13th in the world, and part of that is who's teaching prevention? 90% of vascular disease is due to lifestyle, what we put on our fingers, our forks, and whether we move our feet or not. Is that A number one? Is that A number one what they teach you if you had a cardiac problem? Or is it pill to the ill? Or is it pill to the ill, okay? Or is it wellness? Wellness should be the number one subject at the medical school level. Number one should be wellness. Number one. because that would. And recently I spoke to a psychiatrist, Paul Wilson, Park Center, great gentleman. He was giving a 10-minute talk, and I gave a 10-minute talk. I almost fell out of my chair. It was so great. He said 50% of the people who go see the doctor have mild, moderate, or severe depression. But they come in, that is decorated. It doesn't. They don't come in and say, I'm mildly depressed. They come in, I got a headache, a neck pain, a back pain. I have an atypical chest pain. They don't. So they get misdiagnosed, and they get ill to the pill instead of a proper diagnosis. Think of the money that could be saved. Use your imagination a minute, okay? Use it along with me. A picture, visualize, make a picture. If these people were properly diagnosed, no big-time prescription, maybe teach them some exercise. Remember, a walk a mile is like taking a Prozac. And some eat medication, obviously. And then we teach the other people who come in a bit overweight or one of the skinny fat people, abnormal blood test. And we teach them the 30-day way of eating to get rid of type 2 diabetes, the healthcare savings. Just think of it. Just visualize it. Get rid of diabetes in most of the people, not everybody, obviously, in most of the people, and identify the mind-body illnesses, how much money, what we save. It's beyond comprehension. That's all doable. That's all doable. And I was so excited, and I compliment Paul Wilson for pointing this out, because I'd written a book, Welcome to Your Mind-Body, years ago. And about the mind-body connection is not taught in the medical school at all. Candace Pert wrote a book called Molecules of Motion, 1972. I wrote a book on it a couple of years after that, not taught in the medical school. So what is it all about? It's all about overreading of x-rays. Look at this MRI, boom, 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 we act on that, but we don't teach wellness. We've cut the head off the body, threw it away, and we have organ doctors instead of people who connect the mind to the body. And this is reality. And we're the 16th in the world in breast cancer, okay? And we have 4 times as many diabetics as the rest of the world. Give me a break. All of that is preventable. Get rid of it. And it can be done. And like I mentioned already, the type 1 diabetes rate is rising. It's rising. And chemical exposure, too much milk, for example, not breastfeeding long enough. Breastfeeding is the best thing you can do for a newborn, incidentally, because the mother's milk has the correct ratio of proteins. You see, of the a few thousand mammals that we have, is it 5,400 or something? And they all have different proteins, different carbohydrates in their body. A mouse, for example, has about 6 times as much protein, so it can double its weight in a week. You know, us takes 3 months. So it's totally different if we drink our own milk. Have a look at that. Read Keon Whitewash, excellent book to read. Our pancreatic cells, if you're diagnosed a type 2 diabetic, you come in first, and usually at least half the pancreas is gone because it's been working so hard to get the sugar into the cells, and we've been testing for the sugar, not the insulin, so it's pooped out, okay? But it is not dead, because many of them, we diagnose them so late, it's 90% gone. But they have found you can waken them back up if they eat a nutrient-dense way of eating. The type 1 diabetic who's depending on insulin and sometimes insulin pumps, if he exercises properly, eats a nutrient-dense diet, then he'll need very little insulin, probably live to be 100. The average type 2 diabetic, though, gets in big trouble by the time he's in his 50s. Many of them die 55 or so, yes. So to teach even a type 1 diabetic to exercise and to eat right, and to manage things, and to keep on as low a dose of insulin as you can, then they have a pretty darn good life. But I know enough of them, and some especially who have pumps, eat anything they want to, and they just give themselves a little more insulin. And just keeping the blood sugar normal does not get rid of your disease. That's my point. If you want to get rid of your disease, push it on the exercise and nutrition angle, and then use medications. You have to. It's an emergency. Use medication, for Pete's sake. Medications are great. That your pancreatic B cells are gone when they diagnose you, that's incorrect. They can, many of them can be reawakened with proper thing. And there's science behind what I'm saying, okay? In 1982, Kevin O'Day studied Aborigines Indians in Australia who had eating the Western diet of fat, salt, and sugar. When they used to eat mainly a plant diet, became very diabetic, became obese. Diabetes was sick, heart disease, everything, and took this group and put them totally on a nutrient-dense way of eating. And guess what? All the diabetes went away, vascular disease went away, cancer rates went way down. Scientific proof, okay? They buried it on, it was buried in the literature. No one like the American Diabetic Association could have come out with this, the American Heart Association come out with this and really blew it up. No, they were promoting the fat theory of disease because they're getting a lot of money from industry for saying that. The American Heart Association was founded by Procter & Gamble. Yeah, it's true, it's true. And they put their labels on foods and they get plenty of money over the years over it. That was buried in research. UCLA School of Medicine found after Dr. Christian Roberts proved that 50% of the type 2 diabetics, it had gone away in 3 weeks. Kind of like these books, isn't it? New England Journal of Medicine, 2001, 60% reduction in type 2 diabetes based on lifestyle. And we don't know how extreme that was, so it could have been 90%. So it depends on how compliant the people were. So how much money could we save? Let's face it. You identify the mind by the illnesses and you work on the diabetes, probably $1 trillion. Why? Come on, let's get serious about it. That's what we're spending unnecessarily. And so we need to speak out. Providers need to speak out. We can't just, like the American Diabetic Association, and they train the diabetic trainers. What do they train the diabetic trainers to do? They train them how to manage your medication, okay? Wellness is not number one on their list. I know, I spoke to them. I mean, there's some exception, but there are not many exceptions, okay? And so 1% of the diabetic money that we spend, $400 billion, 1% is spent on prevention when 90% of disease will be gone if we taught people right and then saw them back every month. You can't just say, I'll see you in a year. Let's face it, not everybody can become compliant because sugar is what we use to relieve our stress. We lead very stressful lives, so to reduce your stress in life is important, which you can. Remember what I said, you walk a mile, it's like taking a Prozac, maybe less than that even, so some music, some dancing, some optimism. This brain of ours speaks to our body through neurotransmitters, through hormones and neuropeptides. Candace Pert's book, Molecules of Emotion. Our brain speaks to our body and hits these receptors, okay? And so how we think is important. We're stressed all the time. Steroids go up. Steroids think there's a tiger running at us, and they're going to increase sugar metabolism. You're going to eat more. Chronic stress is the biggest cause of weight gain because cortisol is elevated and causes pot belly, okay? Stress, you're going to have a stress belly. You're going to have a beer belly. You're going to have a weight belly, okay? I'm not being critical. This is a judgment-free zone, okay? I'm just trying to get you well. I don't have to do this. I'm just doing it to make you well. So you got to act on it, though, okay? And so I think what are the main mistakes we've been making? We're fixated on getting the blood sugar under normal control, but that doesn't cure the disease. We need to fixate on wellness. That's what we need to fixate on and control the blood sugar. So wellness should be tried first unless it's an emergency, okay? In other words, you can have perfect blood sugar all the time. Oh, my doctor says my blood sugar is fine, but I'm 20 pounds overweight. You still got diabetes. You're going to get the complications of diabetes. So What am I saying here in summary? Thanks for listening. Excuse my passion, but I get a lot of people. Well, I've got probably a few hundred people are getting rid of their diabetes. It makes me feel good almost once a day that somebody walks up to me. So, in summary, if you get type 2 diabetes, and if you want to better manage your 1 to diabetes, follow this. You can see this. This will be on the TV show next Monday at 7. But it will be on YouTube probably within 2 weeks. Watch it periodically. Read some of the books. I even wrote a book, A Secret of Reversing Type 2 Diabetes. That's a book. Dr. Furman wrote a book called End of Diabetes, Dr. Joe Furman. Read the works of Mark Hyman, Robert Lustig. This is all in the literature backed by me, The 30-Day Miracle by Franklin House, and learn to cook. And I've not a great cook to say the least, but I'm gonna learn this because if you're a diabetic and you don't know how to cook, it's going to be very difficult for you because you just can't eat out all the time and get rid of the disease. Let's make a plan. Come on, let's promise each other. We're going to get rid of this disease. We're not going to accept what industry is doing to us. Call it what you want, but I think we should call them something for doing this to us. And you must open your eyes to it and then do something about it. And exercise regularly, eat right. 30 days, it'll be gone. Good luck. Follow us on our other YouTube, TV shows. I have regularly books, Amazon books, 20 books I got on there. I love you all. That's the reason I'm here today. And feel free to call me, talk to me, and give me a book. I'll read it. Meet you at Starbucks and we'll review it. We love you all. Thank you very much. Maybe see you in the next show.